Good morning. Today, I will provide a brief COVID-19 update for PEI in Canada, and also touch on Halloween, Christmas travel, common rooms in public housing and community card games, international borders, enforcement efforts, and community arenas. There are no new cases of COVID-19 to report in PEI today, so we have one active case in the province, and this individual is self-isolating and has mild symptoms at home. The situation across Canada continues to be concerning, with almost 18,000 new cases in the past week, a 9% increase from the previous week. This represents an average of over 2,500 new cases a day. Public health officials across the country attribute some of this spike in cases to gatherings and activities that occurred on the Thanksgiving long weekend. Quebec surpassed 100,000 cases on the weekend. Other provinces also witnessed an increase in cases in the last week. Saskatchewan, 53% increase over the week before, Alberta, 40% increase, and British Columbia, 36% increase. As a result, many Canadian jurisdictions are instituting restrictions on services and the size of gatherings, reminding people the best thing they can do is to stay apart and find other ways of connecting and supporting each other. New Brunswick officials continue to work to contain the COVID-19 outbreak in their province, reporting a total of 60 active cases, and there were 2 COVID-19 related deaths announced on the weekend. I am very concerned about the situation unfolding in many other provinces for 3 reasons. Outbreaks continue to be a major factor in the new cases in Canada, occurring in long-term care facilities, hospitals, schools, communal living environments, large work settings, and social gatherings. And outbreaks continue to occur in settings where some of the most vulnerable Canadians live. Hospitalizations and deaths lag behind the disease activity by a week or more. We've already seen an increase in ICU admissions in the last week, but we have yet to see the serious impacts of the increases in the number of cases across Canada, including the stress on our healthcare systems. And the second wave of COVID-19 is well underway in Canada. To date, PEI, we have been spared the devastating impacts of COVID-19. But one super spreader event could tax our capacity to conduct contact tracing and provide the necessary critical care for islanders with COVID-19 and those with non-COVID related critical care needs. Ideally, we want to avoid or limit a second wave in Prince Edward Island and stay in the slow burn phase of the pandemic, where we will see sporadic cases and outbreaks, never getting to the point where our population is significantly affected and our health system is overwhelmed. A slow burn is like a steady wave over time with no sharp increases in cases. Our attitudes and behaviors will determine how COVID-19 impacts our province and if we have a second wave or stay in the slow burn path. Our behaviors are important. We have a shared responsibility to protect ourselves and others by following very simple steps: maintaining physical distance, washing our hands frequently, keeping our circle of contacts small, and staying home when we're not feeling well, wearing a mask when in indoor public spaces, and maintain cough, hand, and surface hygiene. We all need to continue to do our part, follow basic public health measures, and protect ourselves and others, and our collective actions matter. My children wanted me to dress up for Halloween today, and I opted to save that for the weekend. But I would like to remind trick-or-treaters and islanders of how Halloween can be safe and fun in the midst of a global pandemic. While Halloween is a special event and a time where we open our doors to ghosts and goblins, I ask islanders to be careful, and there are some precautions that should be respected this Halloween. Children should only visit households in their neighborhood or apartment building and people they know. They should maintain physical distancing as much as possible. Children should not crowd the door of a home. They should move on or stand back and wait their turn. A no-contact pickup option is recommended, with treats being placed on a table or other surface that can be easily disinfected. Children should not have the option to take treats from a communal bowl. If you are handing out treats, wash your hands, avoid touching your face, and wear a non-medical mask. Only one person in the household should hand out the treats. Do not hand out treats if you are not feeling well. I hope all island children and their families have a safe and happy Halloween weekend. Last week, the issue of access to common rooms in public housing complexes was raised. These common spaces are important areas to promote socialization and contact with others within the apartment complex. Our office has identified steps to be taken to support the safe use of these spaces, and I've clarified these guidelines with Provincial Housing Services. Common services in apartment buildings and seniors' housing units can be used provided there's enhanced cleaning and disinfection of the space, as well as access to hand washing facilities or hand sanitizer. When the space is being used, individuals should maintain physical distancing unless they are from the same household or small circle of close contacts. If physical distancing cannot be maintained, a non-medical mask should be worn. In terms of community card games, again, these are important social events and provide entertainment for many people, especially seniors, as we enjoy the PEI winter. Card games are permitted and players should stay at one table as much as possible. Card players should wear a non-medical mask, space out as much as possible, and there should be hand sanitizer at each table, given that they are sharing cards. People attending community meetings should also maintain physical distance and wear a non-medical mask. With the Christmas season and holiday season around the corner, many Islanders are wondering if their family members will be able to come home for the holidays. As I mentioned a few weeks ago, family members who wish to travel to PEI for Christmas from outside the Atlantic bubble must receive pre-travel approval under the Family Connections stream and will be required to self-isolate for 14 days when they arrive in PEI. Provided the Atlantic bubble remains in place, family members and friends who travel to PEI from within Atlantic Canada do not require pre-travel approval and will not be required to self-isolate. I know many Islanders are hoping that family members will be able to travel to PEI without having to self-isolate. But given the second wave of COVID-19 is well underway in our country, and as evidenced by the record-breaking daily case counts in many provinces, at this point, we will be maintaining the legal requirement to self-isolate for 14 days in PEI for the foreseeable future. However, we are always looking at the emerging evidence regarding the optimal timeframe for quarantine. For instance, there's a pilot project underway in Alberta which is exploring alternatives to the 14-day quarantine period for international travelers. We will be following the results of this study and other research around the world. And while we are always evaluating our decisions and guidance using the best available evidence, I do not expect right now that we will be reducing the 14-day self-isolation requirement prior to the Christmas holiday season. To limit the spread of COVID-19, the federal government has issued emergency orders under the Federal Quarantine Act requiring travelers entering Canada to quarantine for 14 days. Provinces and territories can have requirements that are more stringent than what is required under the Federal Quarantine Act, but cannot have requirements that are less stringent than what is required by the Government of Canada. As a reminder for international travelers or workers coming to PEI, they must follow both the federal and provincial requirements related to COVID-19. If a worker is deemed exempt by the Federal Border Services, it does not mean they are exempt from the public health requirements in Prince Edward Island. Our office and partners continue to be concerned with compliance related to certain public health measures, including limiting gathering sizes and following the self-isolation requirements. We take these concerns seriously. We are taking steps to address noncompliance. To date, our enforcement partners have issued 56 charges, 166 warnings, and completed 526 checks at residences. Of the 56 charges, 3 relate to hosting large parties, And we know that large gatherings continue to take place, including indoors and outdoors, and this behavior puts the health of all islanders at risk. There have been over 50 charges that have been issued for failing to self-isolate when entering the province or when directed by a public health official. The majority of individuals who were fined chose to pay the fine. However, some have chosen to plead not guilty. To date, 6 cases have been heard in court, and all 6 individuals were found guilty. I want to remind Islanders that prolonged close contact, either indoors or outdoors with others at parties, has been a significant source of COVID-19 transmission in other provinces, resulting in community outbreaks. Please keep your circle of contacts small, avoid hosting or attending large personal gatherings, and when you're required to self-isolate, please follow the rules that are put in place to protect all of us. Staff and community rinks around the province are working hard to develop operational plans to support safe participation in recreational activities, consistent with the current public health measures. The community arenas vary in size and design and cannot accommodate cohorts of participants and spectators all in the same way. Each operational plan is based on the specifications and limitations of the individual community arena. There's no one-size-fits-all approach for rinks. The safety of athletes, coaches, officials, volunteers, and spectators is the main priority. I ask that people attending events and rinks continue to maintain physical distancing from people outside their own households. Let us be patient with our arena operators, staff, and volunteers as they develop their plans to support a safe return to play. In PEI, we will remain steadfast in our focus to limit the transmission of COVID-19. By containing the community spread of COVID-19, we hope to avoid mandatory and sweeping lockdowns. It's important that we remain committed to priority areas, including supporting the education system to continue to deliver in-class learning, supporting our seniors and others who live in communal living arrangements, and supporting our healthcare system and keep it from getting overwhelmed, supporting our economy and local entrepreneurs, and supporting one another so we can stay in the new normal until the pandemic is over. It is clear that the next few months will be challenging for everyone, and the last few months have been challenging. As I have said before, we are in this for a long haul. But we are so fortunate to be living in Prince Edward Island. We can be proud of how well we have worked together to manage COVID-19 to date. We live in a beautiful province surrounded by caring people. Thank you to all Islanders who are following public health measures and are demonstrating they care about their health and the health of others. As we continue to take collective action against COVID-19, let us continue to be patient and let us continue to be kind. Thank you, and I'll open it up for questions.
Steve Bruce, CBC.
Hey there, Dr. Morrison. Yeah, you mentioned the 56 charges tied to large gatherings and people not self-isolating. How concerning is that to you? And from your perspective, does it speak to a growing lack of compliance or a complacency here?
Hi, Steve. Well, I think those charges, of course, have accumulated over a period of months, and I speak about them today because I think after these measures that having been put in place for so long, I know people are tired of having to self-isolate, and they may not want to comply in the same way, but it's equally important now as it was a few months ago. And when we watch what's going on around the country and we really want to work together to limit the transmission of COVID-19, I think it's important that everyone collectively comply, and if not, enforcement is there, and there are it's part of the public health order and self-isolation requirement.
And you talk about people needing to get pre-approval to travel here for Christmas if they're coming from outside the bubble. Can you talk a little bit more about what that process is, and I guess what you'll be considering as you decide whether people will be approved or not?
Well, we've had the family stream or family connection stream for pre-approval travel in place for quite a long time now, and it is when people are applying for that, they need to demonstrate that there is a good isolation plan in place, and that's really important for all really our streams of travel, and it will be key for that approval process, and also that there is a support here as part of that self-isolation plan.
Thanks so much.
Jason Simmons, The Guardian.
Good morning. This question is for Dr. Morrison. Not sure if it's too early or not, but are you able to shed any light on what Remembrance Day services and parades may or may not look like?
Hi. So we have put some guidance together for Remembrance Day and have been working with some of the legions as well. I've mentioned it before, but it may be a good chance to highlight some of it again next week. They will not look the same as in other years, and really the same public health measures that we've talked about will apply for Remembrance Day. And our gathering guidance and mass gathering guidance will be really important, including Remembrance Day.
Thank you.
Sylvie Pinat, Radio-Canada.
Bonjour, merci beaucoup. La question est pour Dr. Morrison. Vous avez parlé des contraventions remises à certains insulaires. Alors, je veux simplement savoir à quel point c'est inquiétant pour vous à ce point-ci.
Bonjour. Je pense que c'est toujours, ça m'inquiète toujours qu'il y a des gens qui ne veulent pas isoler quand il faut, et puis quand ils ont des grands parties. Alors, c'est une inquiétude depuis des mois, mais je mentionne ces contraventions parce que je sais qu'il y a les personnes qui ne veulent pas isoler à ce moment, ils sont fatigués des mesures, mais c'est vraiment aussi important maintenant qu'il y a 2-3 mois. Alors, les contraventions, on ne veut pas en faire, mais quand il faut, c'est important, une mesure assez importante pour protéger tout le monde et la communauté ici.
Merci beaucoup. Une autre question. Il y a une agence de voyage qui veut créer une bulle atlantique Cuba l'hiver prochain. J'aimerais savoir qu'est-ce que vous en pensez. Est-ce que ça serait réalisable selon vous?
À ce moment, il faut isoler si vous sortez de la boule atlantique pour les 14 jours. Alors, à ce moment, c'est pas vraiment réaliste, mais je sais qu'il y avait un agent de voyage qui a mentionné ça, mais les insulaires qui partent d'ici, hors du pays, hors de la boule, devraient isoler quand ils retournent pour 14 jours.
Merci beaucoup.
Louise Martin, CBC.
Oh, hi, good morning. Thanks for taking our questions today, Dr. Morrison. So mine is going back to how you began the briefing, and that is when we talk about compliance. And we've certainly been hearing some weary leaders. I'm thinking particularly of Manitoba's premier, who basically told his province to grow up and stop going outside and giving people COVID. And I know our numbers here are greatly different than Manitoba. I think has the highest per capita numbers of cases of COVID there. But you know, I can sense that you can feel that frustration as well. So how happy are you with the compliance here, and how much are PEI's low numbers partly can we credit just good old-fashioned luck without having community spread at this point?
Hi, Louise. I think we have done a lot of things here in Prince Edward Island with pre-approval travel, with border screening, with our measures in place, with our contact tracing, with our testing regimes, to really limit the spread of COVID-19. So we know things can change rapidly, and we've seen that recently in New Brunswick, but we have put a lot of work into trying to protect this province from the devastating impacts of COVID-19. So absolutely, we're fortunate, but we've also had great compliance by Islanders, and Islanders for the most part have really done so many things to protect their families and the community. So I think I try to make sure I thank Islanders for that collective behavior that has helped all the other measures that I've mentioned as well, put us in this position. You know, I think now almost 8 months into this pandemic, and but I do recognize that people are tired. We all are of some of these measures, and enforcement is just one part of what we're trying to do. But the other parts are much bigger and have put us in this position together.
Thank you so much. And I'm just curious, too, about, we spoke a while ago about the spit test or the saliva test and also rapid testing. Is there any update on when PEI might see either of those types of testing available here?
So there's still work planning with the saliva testing, and so likely by the sometime in November, we had hoped that some of it may happen early November. I'm not sure if that will be the case. It may be later November before saliva tests are a possibility here. And the antigen rapid tests also will likely be part of what we're doing early in 2021. 90% of our tests for COVID-19 are available within 24 hours, and that puts us in a fairly unique position right across the country. So we probably lead the country in that percentage of tests that are available within 24 hours. So we're already in a good position, so these other testing methods will just help complement what we're already doing.
Thank you very much.
Laurent Rigaud, La Voix acadienne.
Bonjour, Dr Morrison. Pour commencer, j'aurais juste aimé que vous répétiez en français quelles sont les instructions pour cette fin de semaine avec Halloween. Est-ce que les enfants peuvent rentrer dans les maisons? Est-ce qu'il faut qu'ils restent dehors? Pouvez-vous répéter ce que vous avez expliqué tout à l'heure, s'il vous plaît?
OK, bonjour Laurent. Alors, il faut respecter d'être un peu plus prudent. Alors, les enfants doivent visiter seulement les personnes qu'ils connaissent dans leur environ, pas loin de leur maison. Et puis, faut pas avoir trop d'enfants juste à la porte à la même temps. Alors, prendre leur tour et faut pas avoir 10 petits-enfants autour de la porte. Et puis, essayer de mettre les treats comme une table où vous pouvez laver. Et puis, alors, pas avoir beaucoup de contact avec en passant les petits bonbons et on ne veut pas que vous avez un bol et que les enfants mettent leurs mains dans la bol pour prendre les bonbons. Et puis, si vous passez les choses, mettez votre masque, gardez la distance. Laver les mains souvent. Alors, c'est toutes sortes de choses qui vont faire Halloween un peu différent cette année que les autres.
Merci. Et j'avais juste une autre question sur un sujet, sur une question que je vous avais posée il y a quelques semaines sur les les gens qui restent, qui ont des difficultés pour récupérer après la Covid, même après qu'ils soient guéris. Vous avez dit qu'il y avait quelques personnes qui se sentaient pas bien, qui avaient un suivi. Est-ce que vous avez des nouvelles à ce sujet?
Non, pas de nouvelles. Laurent, j'ai même pensé hier soir que j'ai pas entendu des personnes qui ont des grands problèmes après, mais s'il y en a un update, je vais l'amener ici.
Ok, merci beaucoup.
I think that's it. Thank you very much.